Well, it's always hard to predict a flu season before it's happened. We can actually look at Australia, which is kind of in their winter season right now, and they're getting hit by the flu. And they're having a heavier than typical flu season, so we're preparing for the worst. It's still early on, so we're not seeing a lot of patients with the flu at this point, but as we enter into October and November, we'll start seeing an uptick in those patients. It's not too early at this point, and actually on beginning of this month, we've actually started administering the flu vaccination to our patient population. It'll typically last for the season. Some individuals advocate getting the flu shot a little bit later in the season, towards when we start seeing more cases of the flu. At this point, we would advocate just getting it as soon as possible. Some individuals have different types of reactions to the flu shot. Some people will get some soreness at the site of the vaccination. Others may get cough, cold, may get a small fever, and that's just a natural reaction to the chemical of the vaccine going into the body. Children typically don't have a strong immune system, not until they reach their teenage years do they have really kind of that full immune response. And so they're more susceptible to almost any type of illness, including the flu. I would recommend not putting it off because we don't know when the flu season is really going to start hitting. Children can get the flu starting at 6 months of age and above. This year, there's a new flu vaccination called FluMist, which is an intranasal spray, and early signs are showing that it will be very effective to the flu. Yep, it's indicated for patients 2 years of age up to 49, as long as they have a normal immune system and as long as the patient is not pregnant. Yeah, there have actually been some studies showing that as you get older and as you have other medical issues, especially heart disease, that the flu can actually have a really strong impact on those individuals and they can get very, very sick. And so the flu shot naturally just reduces the probability of getting the flu. And if you actually get the flu, it reduces the symptoms. Yeah, I think first and foremost is good hand hygiene. Be sure that you're washing your hands with soap and water. As an alternative, you can use alcohol-based hand rubs. And certainly if you think you have the flu, if you're sick, trying to stay away from people. So staying home from work, keeping your kids home from school during that period of time.